Thank you so much for joining us today. I'm Julie Decker, President and CEO of the FSU Alumni Association, and I'm delighted to welcome you to our Webinar Wednesday series. We planned this series to offer you guidance from our notable alumni who have pertinent knowledge and advice to share in the areas in which they specialize. Remember, you stand with a community of 358,000 fellow alumni bonded by the heritage of our great university. Now more than ever, it's important to maintain a strong connection to that community, and I hope you'll allow your Alumni Association to serve as that resource for you. I have the great pleasure today of introducing our presenter, Dr. Nicole Sparks. Dr. Sparks is a proud three-time graduate of Florida State University. After graduation, Nicole completed Teach for America, the program in Atlanta, Georgia, where she taught high school students in the areas of biology, environmental science, and physical science. After teaching, Nicole went to complete a master's degree in science and then her medical degree, all from Florida State University. Following medical school, Dr. Sparks completed her residency at Memorial Health University Medical Center in Savannah, Georgia. Nicole is currently a practicing obstetrician and gynecologist in Atlanta, Georgia, where she is proudly serving the women of her local community. To pay it forward, Nicole actively works with the I Am STEM program in Atlanta to encourage girls to pursue careers in the areas of science, technology, and medicine. Nicole is also a social media influencer documenting her medical journey as a first-generation doctor. She is living proof of the value of the FSU network and a degree from Florida State. She will cover general tips to keep you healthy, advice for mothers to be, and the best ways to handle stress. Dr. Sparks, thank you so much for joining us today. We're so happy to have you with us.
Hello. Hi, everyone. Thank you for that great introduction. My name is Dr. Nicole Sparks, and like she said, I am an OBGYN in the Metro Atlanta area. I am a very proud three-time graduate of the Florida State University. I had some of my best years there, and so I was very excited to come back and do this talk. So we wanted to make sure that this talk wasn't going to focus on the negative. We all watch the news, we are hearing the stats, we're hearing about all the deaths and everything like that. So this talk is more going to focus on all positive things and ways that we can encourage ourselves and help ourselves during this time. So we're going to divide it into three segments. The first, I'm just going to discuss some healthy habits that you should have during this pandemic and that you should probably have beyond this pandemic. The second, I'm going to focus on my specialty, which is my pregnant patients, and just some questions that I've been getting in the office. And then the last thing, we'll just talk about some ways to decrease stress because no one was expecting to be in a pandemic in 2020, and everyone manifests stress in different ways. And so I just want to give some tips that hopefully will help you. And then at the end, we'll have some time for questions, okay? So first, we'll start with some healthy tips. So, of course, what we all have been hearing is wash your hands. And the reason why we have been emphasizing this is because it is literally the best way to stop the spread of germs, okay? So we always encourage you to wash your hands with soap and water for at least 20 seconds. If you don't have access to soap and water, then hand sanitizer will do, but the best is washing your hands with soap and water, okay? The second is what I think is either tied with washing your hands or right under, and that is social distancing, okay? So this is really important because we know that the virus spreads via respiratory droplets, okay? And that if you are too close to someone and they're talking, and even more if they're coughing or sneezing, that's how this virus is spread. And so if you do not have to go anywhere, if you do not even have to go to the store, you can do grocery pickup or anything like that, then try not to go out because that's really what's going to help us to get off of this lockdown, okay? And then I also want to really kind of talk about gloves and masks because I know people have lots of questions about those. So I just want to first say that neither one of those is a substitute for the first two, which is washing your hands and social distancing. Those are by far the best things you can do during this pandemic, okay? And so I'll talk about the mask. We know in the beginning, the CDC said, okay, well, everyone doesn't need to wear a mask. And they came back and then said the opposite, which kind of confused people. Okay. And remember that this is a novel coronavirus. And so it's new. And so everybody's just trying to learn their way through this. And so I tell people, like, I read, some articles the next day, and I'll read them again on Friday and Saturday, and then it's saying something totally new. And so, we just kind of have to take it day by day and see what's happening. So the reason why the CDC changed their recommendations is because, some new studies suggested that maybe the virus is contained in smaller droplets and that maybe it's kind of hovering in the air for a longer period of time. And so they recommended cloth masks. So why did they recommend cloth and not the other one? So I brought all 3 masks so I could just show you the differences, okay? So this is just a regular cloth mask, okay, that we're asking everybody to wear. And when you're wearing the cloth mask, it's not to keep you from getting sick, it's really to keep you from getting other people sick. And so we know that lots of usually healthy people are carrying this virus and they have no symptoms. They don't have a cough, they don't have a fever, they're not having the loss of smell that now they're saying that people have. And so the hope is that if you are at least wearing a cloth mask, that you are not going to be spreading anything everywhere if you somehow have the virus and you just have no clue that you have it, okay? So these are the cloth masks, and they're saying that you can wear a bandana. Lots of people are making these masks, and they're actually very simple to make. I might start to make my own, but a nice patient made this one for me, okay? The next one is a surgical mask. So this is what you'll see most of us in the hospital wear if you're not actively working with a COVID patient. So if you have a mask like this, I do want to tell you that, again, this is not a substitute for washing your hands. So if you're gonna put on a mask like this, you only wanna touch the edges and then you wanna put it on your face, okay? And you wanna pinch the nose so that it sits right here, okay? Because again, you're trying to keep everything out. But remember, if you're talking to somebody and they cough or they sneeze, then remember, it's going to go to the outside of the mask, okay? So only the inside of your mask is safe, okay? So if you touch the outside of your mask, guess what you have to do? You have to then go wash your hands, okay? So I don't want people to think that, wow, I'm wearing a mask, so I'm safe. No, because if you touch the outside of your mask and it has particles from someone that just sneezed in the vicinity, then you still need to wash your hands before, say, you touch your hair, or what if you touch your mask and then you touch your eyes? Okay, well then that's just bad. Okay, so you just wanna make sure that when you put this on, you're trying to only touch right here. When you take it off, you're taking it off the same way. Because if you touch the outside, you gotta wash your hands. You're kind of defeating the whole purpose, okay? So as far as levels, this is going to be the least effective, okay? This is a little bit more effective, all right? And then our most effective, which you guys have been seeing, is our N95 mask, okay? And this is what the physicians, nurses, respiratory therapists, anybody who's actively working with a COVID patient, this is actually what they're wearing. So what is the difference? So this N95 mask, it fits snugly on your face. We actually have to get fitted for these. There's different sizes, okay? So the difference is that if you see, it's very snug and it doesn't let anything in or out, okay? So this is what you have to wear. We call it PPE, our protective equipment that we wear so that we are not getting infected. So the CDC has recommended that people wear the cloth mask is because we want to be able to save these masks for the people that really need them. And those are for all the healthcare workers that are actively working with COVID-19 patients, okay? So these are the most effective, all right? But the only reason why we're not recommend that everyone has them is because you really want to save them for people that need them the most, okay? So most effective, little bit less effective. Why? Because the size can let things in. And these are the least effective, but if you're not actively working with patients, we do ask that you wear these so that you don't spread unknowingly. Okay, so I hope that kind of broke it down. All right, so the other healthy tip I want to say is just exercise. Okay, so I know it's kind of hard. I know that before this, I had a personal trainer, and that is the only way I could ever get to the gym. I didn't have motivation on my own. So it has been kind of hard leaving work and wanting to do anything. But, I just want to encourage you that exercise helps with, improving your, and making you just feel better, okay? And it improves cardiovascular health, okay? And it can help boost your immune system, and you want to be as healthy as you can during this time. So whether it's just doing some jumping jacks at home, and remember that you can look at stuff online. So a lot of the gyms that are closed, they're still using classes online, so people can take advantage of that. And remember, it is okay to go outside, but you want to practice social distancing. So I have started to run again because I don't have access to the gym. I do wear my mask, and if I'm going to pass by somebody, I either cross the street or we both kind of separate. So, you know, going outside is going to help during this time, especially for those of you who are home all the time, you know, but you can go outside as long as you practice social distancing. Try not to go somewhere where it's crowded, you know, parks or beaches or anything like that. Most of them are closed anyway, but you can go for a run or you can go hiking as long as there's not a lot of people around. Okay, so you want to make sure that you're still doing that. And then of course you want to eat healthy during this time, okay? So lots of raw fruits and vegetables. And again, if you're getting the fruits and vegetables, you wanna wash them off. We don't think that the virus lives in food, but you still wanna be careful about washing everything before you eat them just in case, okay? Because again, this is new and we don't really know. So you just wanna be as healthy as you can during this time, because we know that even though everybody can get it, remember it's not just older people, they are more likely to get sick, but if you have underlying conditions and you are not as healthy and your immune system is not as strong, but that remember that, you know, you are more susceptible to complications from this virus. So during this time, you really just want to be as healthy as you can. You want to exercise, you want to eat well. And one thing that is very important is if you are a smoker, you really need to stop smoking, like stop today, okay? Because we know that this virus is attacking lungs. And so we know that with smoking, okay, we know the effects that smoking has on lungs. And so if you even decrease, but I advise anyone who is smoking to stop because you are definitely more susceptible to having more complications from this disease, okay? So those are a few of my healthy tips. So now I'll go on to talk about just for pregnant women. So this is definitely a really scary time. I'm actually happy I'm not pregnant right now because it's just crazy. You know, this is supposed to be a time where women are supposed to be planning their baby showers and they're planning the maternity shoots and, you know, they're planning for their friends to come over and all of this. And this has shut a lot of that down. So there's no baby showers, you know, you're not going to have all of your family in the hospital. You're probably not even going to be able to have your family to come and help. And so this has really come as a slap in the face. And I'm getting questions every day. My pregnant patients are very, very nervous, including today. They're still very, very anxious, you know. And I just want to encourage, you know, the patients and just let them know that this can still be a very beautiful time for you and not to let all of this that's going on take away from the fact that you're bringing a baby into the world, which is wonderful. And now I will say that some of these guidelines really only apply to mostly the hospitals in Georgia. We know that New York is way more affected. And so again, some of their rules are way more stringent, okay? So as far as what to expect, as far as prenatal appointments, so some physicians are spreading out prenatal appointments and some are doing it via telehealth, meaning we'll talk just like this, okay? And as long as you're feeling baby move and you don't have any issues and you don't have to get an ultrasound, this is sufficient for now, okay? So you might notice that your OB has spread out your visits and things like that so that you're not coming into the office as much, okay? You'll also notice that when you're going to your visits, it's only you. So we are not allowing any support person, even if you're having an ultrasound. And so I know that's not ideal when, of course, you want your spouse there or your significant other there so they can see the baby as well. But I do want everyone to know that this is for your safety, okay? Because anybody extra who we let into the office is a potential for exposure, okay? So you will only have, no one is allowed into the office. That is not the same for labor and delivery. So for labor and delivery, you know, most hospitals are still allowing at least one support person, okay? So your spouse will be able to come. There are some restrictions, meaning that they cannot come and switch out with somebody else. They cannot leave the hospital. Once you're admitted, they have to stay the entire time. And again, these rules do seem like, you know, it's kind of intense, but again, it's just for the safety. We want to protect you. We want to protect your baby, okay? So what happens if you're positive? Again, that's different depending on where you are, you know, so people will ask, well, do I have to have a C-section, okay? In China, a lot of those women did get C-sections, okay? Here in the US, it depends. Sometimes if the mom is really sick, okay, they are recommending C-section because they don't know the effect that it's gonna have on baby. It is not a universal recommendation yet. And of course, if you're not as sick, they may not recommend that. Okay, and some moms are asking, well, can I still breastfeed? As far as I know, as far as we know, this virus does not live in breast milk, okay? The danger in breastfeeding, I should say, is the proximity of the baby to you. So the baby's gonna be right here. And of course, if you see where I'm talking, this easy droplet spread. And so if you are found to be positive, but say you're not as sick, there's different recommendations. So of course, WHO always recommends that you breastfeed because we know that there's very good antibodies in breast milk, okay? But if you're really sick, the CDC has gone as far to say as to recommend temporary isolation, meaning the mom and the baby are in separate rooms, or if the room is big enough to put them on opposite sides of the room until the mom is feeling well. This is not a staunch recommendation. This is something that you and your provider and anybody in the hospital will discuss, okay? If you choose to breastfeed and you're not as sick, you just have to take the same precautions. That means you're gonna wash your hands, you're gonna wear a mask, especially while you're holding your baby and they're close to you. If you're pumping, you wanna wash your pump parts each and every time, okay? We know that pregnant women and babies are overall doing well. Of course, we have heard of a few deaths. There is no proof yet that there is vertical transmission, meaning we do not have definite proof yet that moms are passing this on to their babies during pregnancies. There are some small studies that suggest this, but there's again, a lot of pregnant women who delivered in China and their babies tested negative. So we can't draw any conclusions just yet, but know that more of that is coming. So again, I just want to tell my pregnant patients, like, it's going to be okay. We're still here for you. You know, we're still going to take great care of you. It's just going to look a little bit different, you know? And so I just want to really tell you that during this time, don't freak out. Don't be anxious. Be cautious, and if you can stay home, you know, most doctors were giving our pregnant patients notes for their jobs so they can just stay home because we don't know the effect. CDC is not really considering them a high-risk category, but we still consider them a high-risk category, okay? So we want you to stay home as much as you can. We want you to stay away from everyone, and even after you have your baby. I wouldn't have people over because, again, we don't know the definite effects on infants. So I would not have people over kissing your baby and hugging your baby. I know that it's not ideal to not have your mother and your sisters and your friends over at this time, but just know that what's most important is having a healthy mom and a healthy baby, okay? So that's what we want. And then the last thing I'm gonna focus on is how can we overcome stress during this time? So, you know, I was talking with my sisters and I was telling them, I was like, you know, in the last 2 weeks, I haven't noticed anything different at work, but I was like, I just feel more stressed. I was like, I just feel way more stressed. And so I think that even without knowing it, just with everything that's going on, a lot of us are just way more stressed. So I come home and I do watch a lot of the news and I do read a lot of articles. And the reason why I do that is because I want to be informed. My patients come and they have so many questions. And so I really just want to be informed for them. But just know that you have to kind of protect yourself. So, you know, all of this can get very, very overwhelming. And so I had to tell myself that. And so even for the last 2 days, I haven't watched pretty much anything. I've still been reading articles because I can't help myself, but I've tried not to watch anything because it does get really overwhelming when you're seeing, you know, oh, this many people died and this many people did this and this many people did this. You know, it's just really, really sad, especially for colleagues that I know personally that are in New York. So let's talk about some things. So I know I'm still going to work, but I know that a lot of people are working from home and your coworkers look a little bit different because they're your children. And you don't really want them as your coworkers right now because you are with them all day, every day when they're usually at school. And so I know it's hard when you're having to work from home. And then not only that, but you're also having to help your children with their homework. And my kids are 4 and 1, and I'm really happy about that because I don't know how I would be able to do that right now. So I know that it's hard, okay? So number one, I would say try to keep a routine, okay? It's okay to not have it all together. I've seen these people that have these big, crazy, color-coded schedules and everything like that, but just know that yours doesn't have to look like that. Do whatever works for your family. This is the new normal for a lot of people, and we really weren't expecting this, okay? We really weren't expecting this, so just do what works for you. So keeping a routine really helps. So try to get up at the same time, try to get dressed. If you're doing Zoom, you don't even have to get fully dressed. Just put on the top and then you could have boxers on the bottom. No one's ever gonna know, okay? Unless you forget to turn your camera off. So just keep a regular routine. Same thing with your kids, you know, depending on what ages they are. Keep a lunchtime, keep a nap time if they're younger. So try to just get everybody on the same schedule and get everybody on a routine so that it doesn't become overwhelming. And like I said before, protect your space. So if you find that you're taking in a lot of news, why don't you limit it? So, okay, I'm gonna watch it during just only this time, and then I'm shutting it off, and then that's it. And I probably wouldn't do it before bed because you don't want to read about all this bad news and then go to sleep and then dream about it, you know? So just make sure that you just limit to everything that you're taking in, okay? Take it in doses. Of course, we all want to be informed. We all want to see what the latest recommendations are, but also you want to make sure that you are mentally okay during this time. And like I said in the beginning, exercise, okay? Exercise is not only good for physical health, it is good for your mental health, okay? I noticed that when I started running again, I started to feel much, much better. Even just getting a little bit of sunshine, just fresh air, just being able to be outside, because I know it feels like we're locked in, okay? You're not really locked in, okay? You can go and get some fresh air, go and do some jumping jacks, do some push-ups, jump some rope, do fun stuff with your kids, you know, just get outside and do with them. I was telling my husband that when I go outside, it's the most I've ever seen. There's some neighbors I haven't seen at all since I moved here, and I've lived in this house for a year, but it's making people, you know, come out and spend time with their families. And so I think that's a really good thing. Again, as long as you're maintaining social distancing, okay? And so we can talk about some of the questions. Julie? I'll wait for Julie to come back on. And she had, I think, some participants actually submitted some questions for me.
Yes. You can see me okay and hear
Yes,
me?
I see you.
Perfect. Wonderful. Thank you so much. That was beautifully informative. And I know many are comforted by having you as their physician. I can tell you that for sure. So we did have a few questions that were submitted in advance of your talk with your expertise. So I'll ask you a few here and we'll just go from there. But what are some of the common myths about COVID that you think physicians can or should dispel for some of their patients?
Okay. So there's a lot of myths. There's a lot that's going around. So I will say one again that I talked about in a previous video is that spraying bleach or chlorine on yourself will keep you from getting the virus. And so I tell people, please don't do that. So first of all, if you drink bleach, it's very caustic. It's very dangerous when ingested, okay? Then we'll have to call poison control. You really don't want to do that, okay? And even when you put bleach on your skin, okay, it's an irritant, okay? And you don't want to put it on any of your mucous membranes, so your nose or your eyes, okay? Now, bleach is a disinfectant if you use it for your surfaces. So you can use 1/3 cup of bleach for every gallon of water, okay? So say you know, the stores are out of everything. You can make your own disinfectant, and you want to be able to just wipe down any commonly used surfaces. That's your doorknobs. So when I come home, the doorknobs are wiped off, the fridge, the sink, everything is wiped off, my computer, my laptop, my iPad, because my son uses my iPad, and I wipe off my steering wheel in my car with that. So again, you don't want to drink bleach, okay? But you can use it to wipe off your surfaces. Something else, so garlic. People say that eating garlic will keep you from getting the virus. Again, that's not true. We know that garlic has antimicrobial properties, so it is good to eat garlic and it's very healthy, but it's not necessarily going to keep you from getting the virus. So can you eat it? Sure, because we want you to be as healthy as you can during this time, but it's not necessarily going to keep you from getting the virus, okay? Let me see. I think another one I heard about was that the virus is transmitted across 5G networks. That's just not true. That's just not true at all. Okay, and I'm trying to see, I wrote down some of the other myths. Oh, sitting in the sun. So people say that sitting in the sun or heat will get rid of the coronavirus. So remember, we don't really know what's going to happen. So some people have kind of theorized that maybe as it gets to the summer, that maybe it'll be less, but we don't really know that. But I can tell you for sure that just sitting out in the heat is not going to keep you from getting the coronavirus. Okay, it'll give you some vitamin D. Okay, you might get sunburned, but it will not keep you from getting the coronavirus. So, and even taking hot baths or drinking hot water. So there's just been this thing that anything with heat is going to kill the virus, and that's just simply not true, okay? We want you to literally go back to the basics, which is washing your hands with soap and water, okay? My hands are literally dry because I wash them maybe 3 to 4 times with each patient. Like, that's the best thing you can do. Or if I accidentally touch my mask, I told you guys, because in the office, I just wear this surgical mask. If I accidentally go like this, I'm washing my hands again, okay? So heat, sun, drinking hot water, none of that is gonna help, okay? Any other?
I think that Yeah, I've heard most of those myths, and I think that's always good to hear from an expert of what
And holding your
exactly.
breath. Oh, that's another one.
Oh,
They said if you hold your breath for 10 seconds without coughing, then that means that you're not going to be subject to the coronavirus. That is not true. So we know that it attacks the lungs, but even if you can hold your breath for 10 seconds, if someone comes and coughs on you and they have the coronavirus, then you're going to get it too. So none of these myths are true. And you just want to make sure that you go to reputable sources. Okay. So you can go to, so NEGM, which is the New England Journal of Medicine, is a good source, okay? Of course, the CDC, that's where I go first for everything. Remember, they don't have all of the answers either, okay? But that's just a good place to start, okay? So WHO, the World Health Organization, okay, is very good. And all of these have specifics for pregnant women and breastfeeding as well. So I literally go on there every couple of days to see their updates, and I look at what date it was updated. So I'm able to tell my patients that. So, you know, when I tell them something, I'm like, as of this date, this is true, but this can change, okay? And then the NIH, National Institute of Health. So you just want to make sure that if it's like just some random website, don't believe everything that's on there, okay? If you can remember only two, go to CDC or WHO, and that's where you should start. And if you go to another website, look at their sources and make sure that their sources are also very good, okay? And again, ACOG, which is our organization, the American College of Obstetrics and Gynecology, that's also a good place. So those are really my top three that I go to. So I make sure that I'm always giving my patients evidence-based information, and that's where you should be getting them from too.
very good. This one came in particular from someone who is logged in with us. They submitted ahead of time regarding homemade face masks, which is most effective. And I love that your demonstration, and I think it's worth reiterating and showing those. Which is most effective, reusable cloth or disposable one-time use masks made from shop towels or paper towels are both safe for non-healthcare workers?
So the key is for non-healthcare workers. So if I was actively working with a COVID patient, this is not going to be very good. There is lots of bacteria that can get in and through this, okay? But if you're just somebody who's you just want to wear it because you want to go to the grocery store, really quick and run back, then that's fine. And remember that these cloth masks are not really to protect you, okay? They're to keep you from getting your germs onto everybody else. So the hope is that if everybody is wearing them, then no one is spreading their germs into the air. But if you're actively working with COVID patients, then you don't want to wear this. If you are, non-healthcare worker, then yes, you can wear this. And if you're comparing these two, so like I said, this is definitely more effective, okay? These are the least effective. There are some studies that have come out, they're actually very recent that were kind of talking about the amount of bacteria that can be transmitted through this. And it's pretty high for this. But again, if you're not actively working with, COVID-19 patients, then that's okay. All right, so this is going to be the least effective. Again, this is a little bit more effective, okay? And the reason why it's not as is because if you put it on, remember, I still have holes at the side that are letting things in, okay? And then with the N95 mask, okay, it's completely, I'm not putting it all the way on, but when I do, it's completely fitted across my face so that nothing can come in or out, okay? And again, that's the most effective. So if you want the most effective, you can wear this. But again, we're asking that you don't, if you have them at home, that's fine. But we're asking that you save these for the healthcare workers that really need them.
Mm-hmm. Very good point. Let me see. What extra precautions, I actually have a brand new 3.5-week-old niece myself, and she has experienced what you've been talking about, not being able to have friends over, and my sister-in-law, and I know that's hard. What extra precautions would you tell someone who is pregnant right now? Is there anything, and you mentioned it and touched on it a little bit, but those who maybe find themselves pregnant during this or have recently come home and grandparents want to come visit, or grandparents may be struggling that they can't go visit. What kind of advice are you counseling folks on in your office? Because I imagine you're one of the few people that they can see during their pregnancy and after.
Right. So I'm one of the few people that can't see. So they come and they vent everything to me. Okay. So I will say again, pregnant women, we consider them a high risk group, but the thing about pregnant women is that they're usually pretty young and healthy. So we find that even when they are testing positive, they're actually doing pretty well. So I want pregnant women to take comfort in that. There are some that have gotten very sick, but that is not the majority. The majority of pregnant women are doing very well. Okay. And then I just want to encourage them, because I know that this, again, is not ideal. And, everyone has these dreams. Like, you dream about your perfect wedding, you dream about the perfect pregnancy and how all of it should go. And this is not how any of it is supposed to go.
Mm-hmm.
And so you really just need to take the same precautions as everybody else. And I would say even take extra precautions, because remember, we don't have all of the answers yet. And we don't know if 3 to 4 months from now, they're going to come and say, well, pregnant women are more susceptible and we should have been doing this all along. So of course you want to wash your hands just like crazy. And especially if you already have, like you mentioned, the 3.5-week-old, I would always, just in case you have the virus, you don't know, you just always pretend as if you haven't, meaning that you're always washing your hands. If you're breastfeeding and you even think you may be sick, you start to have a tickle in your throat, you start to have a cough, you have a fever, wear your mask just to make sure that you are protecting your baby, just in case. They are getting better with tests, okay? Because remember, when they first started doing these tests, it was taking a long time to come back. Now we have more rapid tests where we're getting the answers very fast. But, say you do test positive and you didn't know, you want to make sure that you're just taking the proper precautions. And as far as grandparents coming, I've had that a lot. And me personally, when I had my baby, my mom came for 1.5 years with my first baby and 6 months with my second. So I can't imagine not having grandparents come. But I will say that with that, you also have to exercise caution, okay? So we know that the high risk group for sure are people over the ages of 65 who have chronic hypertension and diabetes and asthma and lung disease, okay? And you really don't want to put them in a bad situation. And so I am really encouraging, unless you just have to have the help, I really wouldn't have anyone over, but I especially wouldn't have grandparents over at this time, and especially if they have any chronic conditions, because again, you and your baby are probably going to be fine, but we know that, especially if you're over the age of 65 with chronic conditions, that it can really affect you. So again, this is not ideal, but you just want to protect everyone. And remember that this is only temporary, okay? We're hoping that the peak has already come, or that it comes soon and we can kind of get over this, and then you can really enjoy this. And if you're someone who's newly pregnant, again, we don't know about anything. We don't know if this causes miscarriage. We don't think it does. We don't know about birth defects. Again, we don't think it does. I talked in a previous video about how when Zika virus came, we know for a fact that this causes birth defects. We know that we do not want people getting pregnant if you possibly have the Zika virus, okay? We literally tell people to wait 3 months if you think you may have had an exposure, because there are multiple defects. You guys have seen the pictures, especially with the babies in Brazil, than what happens with Zika virus. We are not seeing that at this time. But again, remember that people who are newly pregnant have not delivered their babies yet. And so we just don't know. We're not going to have any real answers until everyone who is pregnant right now delivers in 8 or 9 months. And if their babies are fine, then we can start to see some studies that I know are going to come out around that time. But for right now, if you are pregnant, I don't want you to be worried, because for right now, we don't think that there's any association with birth defects or miscarriages or anything like that.
Great advice. Okay, and I think, let's see, we have, I'm going to switch it up on you here. I'm going to go to the last, because I think this is good and I think it's worth reiterating. Where should we really be getting our information? I think you mentioned 2 sources, and I think it's worth reiterating, because there's such information and we're home. And so we're either accessing our phones or computer or watching TV. Where would you perhaps on some of those mediums, on TV or on the internet, suggest that we be getting information from?
So again, I always start with the CDC, just because that's who's meeting and kind of making like the big decisions. And then again, I go to WHO, which is the World Health Organization. That's usually my second site. I also go to ACOG, which is the American College of Obstetrics and Gynecology, and a lot of their sources, again, come from CDC or WHO. And if you're watching TV, it depends on who's talking. So you just want to make sure that the source is actually reputable. So if they're quoting things, usually people will tell you where they're quoting from. If they're quoting from one of these sources, okay, then you can believe it, okay? If they're just kind of telling their opinion, you have to take that with a grain of salt. So everybody has an opinion during this time, but really we just want evidence-based facts, okay? And just remember that these facts are changing every day. So I know that people may have a difficult time like trusting the news sometimes. And one of the biggest things is that when we were told not to wear masks, and then all of a sudden we're told to wear them. And so I know that a lot of people are like, well, why did that come out of the blue? And they don't know what they're doing. But remember that you have to give everybody some grace because this is really, really new. And so there's a lot, like, honestly, every day, every other day, there's new studies coming out. So we're reading these studies and we're like, okay, well, China had everybody wearing masks and now it's gone. So, why don't we try this? So remember that every time studies are coming out, we're trying to see what's going to work with us in the US because it's so bad here. And so just depends, just make sure that whoever you're listening to, I watch pretty much all the news sites, but make sure that whoever they have talking is actually an expert, their credentials, this is what they do. And then I would say that you can trust that. Okay. But I would always start with kind of, those are my top three that I really, really trust.
Great. Well, I have one other question because you mentioned your sister wants you to move back to Tallahassee. So what is your favorite FSU memory?
Oh my goodness. There's so many good memories, and I was there for almost a decade. I think the biggest thing is I miss the football games. I haven't really come back to a homecoming in a while, and I need to do that.
Yes.
But I really just miss just seeing garnet and gold everywhere. And of course, the garnet and gold guys who are always dancing, and just like the energy you would feel when everybody is, singing our chant and the band is playing and everything like that. So I really, really, there's just nothing like an FSU football game. There really isn't. Hopefully we'll get back to winning some championships, but we did win our last one, my last year of medical school. So I'm really excited about that. But, Florida State was, just a really great school, and the medical school is amazing. The professors were amazing. And, Florida State's just wonderful. And I'm just glad that, I got my degrees from there, and, it's just really great.
Well, then you may be our good luck charm, and we're going to hold you to it.
Yes.
So we'll keep that in mind. Well, thank you so much for joining us. Our university is better because of alumni like you. You are making a difference in the world. I know you're making a difference in the lives of your patients. So thank you for taking time for sharing your expertise with our alumni and our friends today. And we also want you all who are with us on this webinar to come and join us again next Wednesday as our series continues with Mental Health Matters featuring Dr. Teresa Kemper. And for more information on COVID-19 resources, you can always visit alumni.fsu.edu/coronavirus. And we've listed actions we've taken as your alumni association, and we've also listed some resources there for you that we hope that you'll find informative and engaging as you find yourselves at home. With that, thank you so much to our members. Thank you again to Dr. Sparks, who is with us, and she is also a member. We couldn't do it without you and those who have invested in membership in the Alumni Association that allow us to take the message forward. So thank you again, and go Noles.
Go Noles.